In 2012, 12.5 million people reported using painkillers without a prescription.
Anyone who tells you it isn't personal isn't telling you the truth, because 1 in 4 households is wrestling today down the street right in your neighborhood with an untreated addicted person in the family.
In addition to being a state senator representing people in the city and county of Denver, I've worked for 23 years as a primary care physician in internal medicine. And I worked most of that time with the community health center, and we would actually get a disproportionate number of people with chronic pain who needed ongoing medical therapy.
I practiced pharmacy for about 35 years, and in that time frame I got to see up close and personal folks that started out just needing a medication for a given illness that gradually degraded to an individual that was physically ill, mentally incapacitated, spiritually incapacitated, and became virtually a shell of themselves.
The scary thing is it's an always progressive fatal illness if you don't treat it. But on the positive side, it's got a very good prognosis for recovery if you'll provide treatment. Because untreated addiction drives costs in states in ways that are unimaginable.
Right now in my own state, the number of people who die from prescription drug overdose deaths is greater than the number of people who die from automobile deaths.
The main thing that I've noticed is that we have more patients who are using narcotics for non-malignant pain on a chronic basis.
It is like a pharmaceutical atomic bomb dropped in the middle of a community.
Good legislation has certainly changed the landscape of the prescription drug epidemic in Kentucky. We've established a model mandatory prescription drug monitoring program, as well as effective pill mill legislation.
Most states have prescription drug monitoring programs already on the books.
Anytime a controlled substance is dispensed, a pharmacist will put it in a database, and then a provider can look up this information when somebody comes to see them with pain to see if this patient has gotten medication recently from other providers, or if it's somebody with chronic pain, you can go onto this database and be sure that they are using the drug appropriately according to how you've prescribed it.
And we have interstate cooperation. We live 20 miles south of the Montana border. The Montana pharmacists have the same access to the Wyoming database if it's a Wyoming patient.
There are folks who do require pain medications on a consistent basis, terminal cancer patients being the first example that comes to mind. A number of pain clinics actually became a little more than pill mills, places where people could go to get their narcotic medication and would pay cash.
There has to be regulations. On the pill mills, the clinics, there are certainly people who need these drugs, but we've got to make sure they don't get out and that they're not given out easily.
Those of us who are general doctors have ended up wanting to help our patients with pain and giving them prescriptions for pain medication. I think our providers need to be re-educated that if they dispense these medications to people, they should be letting people know that there is a risk of diversion, that there is a problem with abuse in our state, and giving them advice on safe storage.
We need to make sure that when you get a prescription that it's limited enough that you don't have quantities laying around in your medicine cabinet for people to get.
Just educate the everyday person that when you get a drug, that it is a dangerous chemical and you need to put it somewhere where it's safe and can't be diverted.
We work harder at training physicians and physician assistants and nurse practitioners. They're utilizing more physical therapy. They're utilizing more naturopathic methods of dealing with pain. They're talking to their patients about ways to cope with pain.
There are 4 avenues that you've got to travel to be able to get where you want to get with regard to substance abuse, and that's prevention, intervention, recovery, and treatment.
State legislatures can do a lot here. I think they need to take a look at what they have on the books.
And probably most importantly, get out into your communities. Have some town halls on substance abuse and listen. And once you've heard that narrative and you put it together in your mind, you will be very active in trying to do something about it.
This is a huge burden on the states. We have tremendous opportunity with the Affordable Health Care Act, Parity Act that's in effect for drug and alcohol and mental health.
I think we need more data on where is it happening and how is it happening.
It's when we unite under a common umbrella that we can get a 360-degree vision for the road ahead.
If substance abuse were looked at as an epidemic in the same way we would look at say a smallpox epidemic, what amount of resources would we apply? We would apply whatever it took. We haven't done that.
We know how to fix this problem nationally, we just have lacked the will to do it.